हेलो एवरीवन एंड वेलकम बैक टू माय प्लेलिस्ट ऑफ पैथोलॉजी। लंग की पैथोलॉजीज हम कर रहे हैं और आज एक बहुत इंपॉर्टेंट टॉपिक स्टार्ट करने जा रहा हूँ, पल्मोनरी इन्फेक्शंस। Respiratory pathogens lead to infection of the lung, and this is what we call pulmonary infection. Now, these can be all microorganisms, including, for example, bacteria, viruses, even fungi. There is a range of disorders. आज की वीडियो इंट्रोडक्टरी है, so we'll talk about some general principles और फिर अलग अलग करके we will start covering bacterial respiratory infections, viral respiratory infection, and so on and so forth. Okay, so let's try and focus on some very basic principles of pulmonary infections. अब देखें, to begin with, you should know the importance. Pulmonary infections in the form of pneumonia, and this is what we use the word for it, pneumonia. Whenever there is pulmonary infection, that is involvement of the lung parenchyma and basically any structure within the lung, and this is known as pneumonia. And look at the statement here. They are responsible for 1/6 of all the death in the United States. So even in today's date, this pulmonary infection is one of the major killers. It is still in top 10. Despite all our inventions with the antibiotics and diagnostic modalities, it is still a very, very common cause of death, even in the most developed countries of the world, such as in the United States. Imagine the condition in our part of the world, in India, Pakistan, Bangladesh, Sri Lanka, where number one, access to advanced healthcare facility is not easy for everyone. Number two, it is usually not affordable for everyone. And number three, the culture. Many of the people don't seek medical advice until it is very late. So with all these factors, imagine that the pulmonary infection associated mortality would be even higher in our part of the world. So pneumonia, so this was to pitch the importance of the topic. This is very important clinically. Pneumonia can be broadly defined as any infection in the lung. So that's the broadest definition you can think of. Normally, the lung parenchyma remains sterile. It's a beautiful, beautiful system in the lung. Although it is, if you look at it, it is directly connected with the exterior. So if this is the bronchus, and then these are the bronchi and the trachea, and this is then the lung structure, which is present in your chest cavity. But this airway is in direct communication. So if it goes upward, there is a pharyngeal area, then the nasopharyngeal area, and the nares, the nose. Through the nose, the nasal opening, air enters into the system. Also, there is a mouth, and through the oral opening, air also can directly communicate with this system. So the point is that the lung interior is in direct connection with the exterior world. Now, despite this fact, most of the time our internal lung structure remains sterile. Now, that is because there are super efficient defense mechanisms present, और वो उन पे थोड़ा सा भी हम comment करेंगे. So normally the lung parenchyma remains sterile because of a number of highly effective immune and non-immune defense mechanisms that extend throughout the respiratory system, right from the nasopharynx to the alveolar spaces. यानी nasal pharynx से लेके पूरा अंदर तक, it is all very nicely protected. और वो protection layers अभी हम देखेंगे. However, the vulnerability of the lung to infection despite these defense mechanisms is not surprising. Obviously, it is in direct contact with the exterior, so it is highly vulnerable to infection. As you know that many of the microbes are airborne. Think about TB, think about COVID, for example. Think about other pneumonia-causing organisms. So they can enter in your nasal cavity by air droplets because they are airborne. Nasopharyngeal flora are regularly aspirated during sleep. इवन पूरे दिन में हम अक्सर, वो कभी कभी होता है ना, खास तौर पे सर्दियों के मौसम में, कि बलगम जैसा आता है, ऐसे किया और वो भी swallow it. So we actually are swallowing a lot of flora of the nasopharynx. Nasopharynx में जो बैक्टीरिया है वो हम अपनी बॉडी में खुद ingest कर रहे हैं. So that's a very common phenomena. Lung diseases often lower the local immune defense system. That's part of the routine inflammation. The importance of the immune defense in preventing pulmonary infection is emphasized by patients with inherited or acquired defects in innate immunity or adaptive immunity. अब ये ज़रा सुनिएगा. वो कहते हैं कि कोई नेमत समझते हैं, ब्लेसिंग. जब कोई ब्लेसिंग होती है ना, तो उस वक्त उसका इतना पता नहीं चलता, लेकिन जब वो ब्लेसिंग हट जाती है तो उसका बहुत ही शिद्दत से एहसास होता है कि वो कितनी इंपॉर्टेंट ब्लेसिंग थी. So for example, I mean, look at the people who, for example, are missing one of their limb for any reason. Look at a person who is affected with polio, cannot walk properly, and then compare, your blessings, that this really is a blessing, na, कि आप properly walk कर रहे हैं. If you start thinking this way, many of the problems will not look like problems to you, because real problems are something else. बिल्कुल ऐसे ही हम रोज़ाना की बुनियाद पे ज़िंदगी गुजार रहे होते हैं और हमें इन्फेक्शंस नहीं हो रहा है, हमारे लंग का इम्यून सिस्टम काफ़ी स्ट्रॉन्ग है. बट सी दोज पीपल जिनमें अगर कोई इम्यून डेफिशिएंसी है, इनेट इम्यून प्रॉब्लम है या एडेप्टिव इम्यून प्रॉब्लम है, दीज आर द गाइज जिनको रूटीनली लंग इन्फेक्शन होता रहता है, एब्सेस होते रहते हैं. एंड द रीज़न बीइंग क्योंकि उनका इम्यून सिस्टम ठीक से काम नहीं कर रहा, तो आपकी बॉडी में जो माइक्रोब एंटर हो जाता है लंग के स्ट्रक्चर में, इम्यून सिस्टम उसको हैंडल कर लेता है. लेकिन वो लोग जिनमें ये इम्यून सिस्टम डिफेक्टिव है, उसमें ये डिफेंस मैकेनिज्म काम नहीं करता. सो फॉर एग्जांपल देयर आर पेशेंट्स नोन जिनमें मिड 88 mutation है. Now that is a very important protein. It is required for signaling by the toll-like receptors, which are extremely susceptible. These patients are extremely susceptible to severe necrotizing pneumococcal infection. यानी normal आपके immune system को काम करने के लिए TLRs are very important, and they interact with the pathogen, and then the immune system is activated. All this system require a special protein called MID88. If MID88 is mutated and it is not functional, then TLR receptor pathway doesn't work, and the person is susceptible to necrotizing pneumonia. You see, serious. इसी तरह जिन लोगों में IgA deficiency होती है, now that's an antibody which is secreted in the secretion. So for example, in the nasopharynx, there is IgA. So if IgA is not there, so this is a layer of protection missing, and these guys are then susceptible to encapsulated organism infections such as pneumococcus, H. influenza. So see, these two things missing, MID88 and IgA, and it causes serious problem. On the other hand, defects in the T helper 1 category of cells leads to increased infection with intracellular microbes such as atypical mycobacteria, which is usually handled by Th1 helper type of cells. Much more commonly, lifestyle choices interfere with host immune defense system. For example, cigarette smoke compromise the mucociliary clearance. So, आपके trachea के अंदर छोटे-छोटे सीलियाँ हैं, mucus है. If the microbes and the dust particles are coming in, so they try to push them upward, but they are destroyed by smoking. So if somebody is smoking heavily, this system is gone and the microbes enter into the lung and causing more and more lung infections. Okay. And it's also impair immune cell function such as neutrophil function. Bacterial pneumonias are classified. Now, as I told you, any organism can cause pneumonia, bacteria, viruses. So if we talk about the bacterial pneumonias, they are usually classified according to the etiologic agent. So for example, abhi hum next video mein karenge bhi कि pneumonia caused by streptococcus. Then we'll talk about pneumonia caused by H. influenza. So these will be separate topics. So this is how they are usually classified. Altogether, 7 distinct clinical settings are recognized, each associated with a fairly distinct group of pathogens, and they are summarized in the table. We'll have a look at the table in a moment, which is table number 13.5. So one group is known as community-acquired pneumonia, bacterial, then community-acquired pneumonia, viral, then nosocomial pneumonias, then aspiration pneumonias, chronic pneumonias, and necrotizing, so that's even more serious, and pneumonia with in the immunocompromised patient. So for example, if somebody is associated infected with HIV or taking steroids, or pregnant females, so immunocompromised host, and then the pneumonia. So these are the 7 groups that we have to be aware of at all the times, and we'll start doing them one by one. We see they are caused by different organisms. Community-acquired pneumonia caused by bacteria, then by viruses, then there are nosocomial, aspiration. हर एक की अलग etiology है, अलग organisms हैं, okay? ये सब हम detail में discuss करेंगे. Thus, the consideration of the clinical setting can be very, very helpful when antimicrobial therapy has to be given empirically. So, if, for example, the patient is present in a hospital setting, then you think about different set of organism. If the patient is present in the community setting, which means the person is simply at home or working, then you have in mind these sort of organisms, and this guides the initial empirical therapy. Because start में आप specific therapy नहीं देते, obviously you have to sometimes send culture and sensitivity, most of the times rather. तो initial empirical therapy में हिस्ट्री बहुत इंपॉर्टेंट है. So that will guide you towards what you should initiate as a therapy. Okay, so I'll stop the video here. That's the generalized introduction. From next video on, we will start specific pneumonias. Take care of yourself.